Hi, everybody. We're going to get started here in another minute just to make sure we've got everybody who would like to join on. One more minute, everyone. Welcome, everyone. I'm James Flensha, Regional Resource Director with Care and Treatment Centers. Thank you all for joining us for today's webinar entitled Sirens Stressors and Unyielding Service, How to Address the Unique Mental Health Challenges Facing First Responders. As a reminder, we'll be conducting the session in webinar format. All participant microphones will be muted and cameras will be turned off, but we'd still love for you to interact with us. Please feel free to send your questions through the chat or Q&A feature. We save time at the end of the webinar to answer your questions. Depending on the volume of questions, if we can't get to your questions before the end, we'll have someone of our team follow up with you directly. Today's presentation is eligible for 1 credit through the American Psychological Association. If you're interested in receiving this credit, you must be on for the duration of the presentation. Please watch your email after the presentation for a link to complete an evaluation from cego.com. After finishing the evaluation, you will have the opportunity to download a certificate and you will have the completion of it immediately. Today, I'm very proud to introduce our presenter, John Becker, Jr., who is the Director of Care and Treatment Center's First Responder Program. John possesses years of experience as a police officer, clinician, outreach professional, and program developer, as well as a strong understanding of substance abuse amongst first responders, having overcome addiction in his own life. John is also the clinical director of the Pennsylvania Montgomery County Critical Incident Stress Management Team and certified by the International Critical Incident Stress Foundation for Individual and Group Interventions. Additionally, John currently serves as the Vice President of the Executive Board of the Greater Philadelphia Chapter of the Employee Assistance Professionals Association. Thank you, John. Thank you so much for joining us today.
My pleasure, James. Thank you for the introduction. So good morning or good afternoon, everyone. It's now after 12 o'clock. So I want to welcome everybody to today's webinar. It's kind of a timely topic we're going to talk about today. The stress that first responders face, but more importantly for today's purposes, how that is has been increased through the COVID-19 pandemic. What that looks like among first responders and what we can do, both as a community, individually, as organizations, to address some of the problems that are arising as a result of the pandemic. So in order to kind of dive into the pandemic piece, I think we need to understand what the professions are like to begin with, what it means to be a first responder, and some of the day-to-day challenges that face our men and women that serve in uniform. So when we talk about first responders, we know that it's a difficult and demanding environment in which they work, right? They run towards danger, not away from it, as most of us do. It's their job to handle crisis and critical incidents. So there's a lot of stress that comes along with that, just going to work every day. The first responder world is full of proud traditions, uh, you know, long time honored traditions that are very important to the men and women that serve. So there's that piece of the culture that comes into play. First responders undergo extensive training, from the police academy all through or the fire academy, all through their careers, depending on what their profession is, right? Police, fire, EMS, corrections, doesn't really matter. There's extensive training to get into the profession, and then it's ongoing. Right? Every year they have to attend mandatory training, and then there's various other trainings that they are involved in. First responders operate in an atmosphere where they have to be decisive, and their mentality has to be unhesitating. Life or death situations sometimes where they have to make split second decisions, and not everyone is equipped to be able to do that. They need to be able to evaluate what's going on in front of them and make quick, sound decisions based on what they're seeing, right? So that's challenging in itself and create a lot of stress. First responders believe in service, citizenship, and responsibility, right? They take their roles important. Most don't even see it as a job. They see it more as a calling, as who they are, not what they do. So that's really a big part of the first responder world. And the other piece that's really important is they're taught to take care of everyone else. They often put themselves second, neglecting their own self-care, their own, emotional and physical needs in the interest of other people. And it's important to keep that in mind as we go through this. That's probably one of the biggest factors to keep in mind. So when we talk about first responders and the risks that they face, one thing we need to address is occupational stress injury. And what are we talking about with that fancy term? And in essence, it describes a wide range of psychological conditions that can develop within first responders. They result from the performance of their duties, right? It's occupational, specifically related to the performance of their job. It's not something that's happened outside of work, in their childhood, or at home. It's related to work. These occupational stress injuries do interfere with the first responders' personal and professional life. Often that impact shows up at home first in their personal life, but eventually it spills over into their professional life. And those injuries present themselves as things like anxiety, depression, post-traumatic stress disorder, things like that, mental health diagnosis that impact their ability to function in daily life or be impacted by the events that they're involved in. So that's a constant piece of what a first responder is dealing with when they go to work every day. Now, when we talk about uh, other stressors that are present, right? The first responder world is unique in their scheduling, in that they often work long shifts, changing shifts, overnight schedules, holidays, right? While most of us are sitting at home enjoying Thanksgiving dinner, our police officers, our firefighters, and our ambulance workers are, at work, keeping us safe. So those schedules and those changing shifts, over a 20, 25-year career can have a significant impact on a first responder. Um, Poor sleep. We see this a great deal among first responders, often because of the shift work or because of, the long schedules and changing schedules. Many first responders have difficulty with proper sleep, either not being able to get to sleep or interrupted sleep, things like that. And we know lack of sleep can lead to a whole lot of other problems, a whole host of other issues to be dealt with. So very common among first responders. Being or feeling helpless, you know, something that we may not think about quite often, but a first responder's job is to help and protect people. And when they're not able to do that for whatever the reason is, or, they come up short in the attempt of that, that has a significant impact on a first responder, emotionally, mentally. Um, Although they do get an extensive amount of training, it it's often not adequate, right? Uh, Not every department trains at the same level. Not every agency has the same resources to provide the most current, the best, evidence-based treatment or training for their members. So we see that often in the first responder community. We'd like to think that first responders have all the best equipment and best communication gears out there, but at times, things break. Uh, Takes time to get equipment replaced, things like that. So they may be responding to a call without all of the tools normally available to them, not being available, right? So things that they deal with on a regular basis. Family issues. First responders are no different than any other citizen when it comes to family dynamic and family stress and family issues. So I think it's important that we keep that in mind. Sometimes we hold first responders up to a higher standard or consider them different than an average citizen. In some ways they are, but when it comes to family, they're just like everyone else. Administrative challenges is also another issue first responders face. Leadership isn't always as supportive as they want to be, or sometimes it's political stuff that comes into play, or sometimes it's just perception. It doesn't have to be reality, but the administrative piece of it is a big stressor for first responders. And survey after survey, when asked, first responders will list, administrative stress is one of the top, 2 or 3 things that they struggle with. Expectations. We put a lot of expectations on first responders. We almost expect them to be perfect, and we lose sight of the fact that they are human. But more importantly, they put a lot of expectations on themselves. And when they don't meet those expectations, they often take that very hard and they struggle with that. So I think, again, and all of these things put together are stressors that first responders deal with on a regular basis, regardless of where the pandemic stands, right? So when we talk about critical incidents, right, and traumatic events, that's on top of the day-to-day stuff that a first responder is dealing with. Now we move into critical incidents and traumatic events, things like, the death of a child, failed rescues, not being able to save somebody that they've worked really hard to save, in an ambulance, things like that. First responders are exposed to these type of critical incidents and traumatic events, at a much higher rate than the average citizen. For some of them, it's daily, right? The average person may experience 1 or 2 critical incidents in their entire life, where a first responder, it's part of the job. So that's on top of the other stress. So what do we know about these first responders that are dealing with all this stress? We know that they're reluctant to ask for help and they want to be in control, right? When a police officer shows up at a scene or the fire department shows up, they're in charge, and they take control of a chaotic situation, and they bring stability to that event. So when they're faced with something that they can't control, they struggle with that. And when we talk about mental health or substance use disorder, a big struggle for first responders is admitting that they have a problem, is like admitting that they're not in control. And that's very, very difficult for them. On top of that, you have the fear of stigma. Um, there's still stigma attached to substance abuse, mental health issues, things like that. So for a first responder, it's even a greater stigma, right? They're supposed to be perfect, whether that's real or perceived, but in their minds, they're seen or held to a higher standard. They hold themselves to a higher standard. So they take this even harder. And there's the fear of the job consequences, right? If I admit that I need help, what does that mean at work? Am I going to lose my job? Am I going to be seen as weak or broken? Am I going to be judged? All the things that they worry about, that keeps them from reaching out for help early on, and often, keeps them from reaching out for help until they're kind of forced to get help sometimes. What we often see in first responders is an expression of outward anger, which is really based on their inward fear. which in their minds is unacceptable, right? Fear is not part of the equation. So they're very comfortable with strong emotions like anger, or frustration, things like that, where fear, isn't part of the culture. It's not part of that A-type personality, running towards danger. Um, they struggle with that. And we're not talking about fear of physical harm so much as we're talking about, emotional fear of, all these things we just listed there, but, fear of discovering that they're not quite perfect or that they don't have everything in control. So that's a big struggle for first responders. Now, we throw on top of that the pandemic, right? And the impact of this pandemic and the magnitude of it is really only two events in recent history match that, and that's the HIV epidemic in the 1980s and 9/11 in 2001. The pandemic has led to changes in so many aspects of our lives, separate from the first responder world, just in how we deal with life on a daily basis, how we work, how we have trainings, right? Today's webinar is an example of that, and how we play, right? For a long time, we were kind of locked in, not a whole lot of activities going on. Um, these changes have been difficult for everyone, and it has impacted everyone emotionally, mentally, physically, this year plus pandemic. So it's all affecting everyone. It's significantly more profound for first responders, and we're going to talk about why in the next couple slides. So they're dealing with all the things that we've just talked about, the impact of the pandemic, and then on top of that, they're also struggling with pandemic-related stressors specific to their chosen professions, right? Longer hours than they were working before, and days, canceled days off. For a long period of time, there was a lot of, you know, uh, isolation. First responders didn't stop working when the pandemic hit. So there was a lot of risk of exposure. And if there was a chance of exposure or there wasn't exposure, a whole squad, a whole platoon, a whole unit could be sent home. And that meant that the other officers were now working, double time, triple time, things like that. So a lot longer hours, a lot of days canceled off. A lot of quarantining going on, multiple exposures over, the life of this pandemic have meant that, a firefighter, may have had to quarantine himself, 2, 3, 4, 5 times, um, because of the exposure from doing the job. Fear of the virus, right? Just the knowing that they're in a position, in a role where they're coming in contact with folks that have the virus, right? So that brings along its own stressors. The other thing that they struggled with is the fear of putting their family and their loved ones at risk, right? I go to work. It's one thing to expose myself to this, but then am I going to take it home to my family, right? What's the impact of that? Um, and then the other piece is the changing orders that have come over the last, year plus, with, how they're to do their job, changing um, CDC recommendations, changing roles within their agencies, how they're to perform their jobs, what they can and can't do. It's kind of been an ever evolving process for the first responders, just as it has been for the rest of us, right? So all of these things come into play when we talk about stressors related to the pandemic. Um, some other things to consider, right? When the pandemic hit, clinical services became less accessible. So for all of society, a lot of things that we normally relied on for our well-being were changed or stopped. Um, in the substance abuse treatment world, things like AA meetings, weren't live for a long time. So people that relied on them for their well-being weren't able to go. Virtual kind of jumped in and tried to fill that void, but it's definitely different. A lot of the normal coping mechanisms that were available to first responders were no longer accessible. Um, for a while there was a struggle just to get personal protection equipment, PPEs. First responders were doing jobs and being exposed without proper equipment. That causes a lot of stress. Forced isolation within their own agencies, right? Um, you have the quarantining of a squad, within a fire department or a police department. um, they can't even be around their own, colleagues because they've been exposed, right? That takes a toll. The first responder world, there's a strong peer component to that, that fraternity, that they support each other and stand with each other and all of that. So when you're isolated from your own colleagues, it can have an impact. And within all of this, they're being tasked with maintaining public safety, right? The general public, has their own reactions to what's going on with the pandemic, and it's the job of the first responders to maintain that public safety, make sure that services are being rendered, that people are being kept safe and all those things. So all of this compounds the daily stress that a first responder struggles with. So what do we see from that? What are the consequences of, the COVID-19 pandemic on top of the normal stressors that first responders experience? What we've seen is an increase in the number of first responders that are seeking or that are having mental health issues, including SUD, right? Um, Anecdotally, we know that we've experienced more calls. Personally, I can attest to over the last 16 months, I've received more calls from first responders struggling with anxiety and depression and things like that than I have in the last 10 years of working with first responders. It's been increased greatly as a result of COVID-19. Um, we know that the COVID-19 exposed first responders are reporting significantly higher alcohol use than non-first responders, right? Alcohol is a part of the first responder world to begin with. It's part of the culture. It's often used as a coping tool. So when things get elevated, we're seeing more reliance on it than we have in the past. Um, so that becomes an issue. And as I mentioned, anxiety and depression symptoms are present with and without this exposure. What we've learned is, some of these folks that are struggling, may not have had an exposure, right? But just being present around this whole situation has had a negative impact, along with the other things that they're struggling with. We also know that the implications from COVID-19 for first responders' physical health is without precedent because of the scale of the pandemic's impact, right? We still don't know the full extent of how the pandemic is going to impact the first responder world or society in general, right? So we must recognize it as a critical event that is likely to induce trauma responses. I think that's the key to this whole thing. Um, First responders experience critical incidents and traumatic events on a regular basis, but very rarely do they last, a year plus, right? The pandemic's been going on for a long time, and they've been living in that environment for the last year. Definitely has an impact. So when we're concerned about our first responders, whether it's, from a peer perspective, a administrative perspective, a treatment provider perspective, some of the things that we want to look for with our first responders in kind of talking about, okay, how do we recognize when something might be going on? Well, some of them are pretty easy, right? Appearance, if somebody's coming to work, and they normally come in squared away, uniform looking good and things like that, and now they're rolling into work looking like they just woke up and they slept in their uniform, that might be a flag that something's going on. Performance is another measure that we can look at. Are they doing their job at the level that they normally do it at, or is their performance off? Change in demeanor, this is a big one. If you have a first responder that is normally pretty easygoing and laid back and slow to kind of react to any problems or anything like that, and all of a sudden, they seem angry or just off more often than not, changing their demeanor, how they interact with the public has changed or with their colleagues. That's something that should be, looked at to say what's going on. Isolation, right? For a first responder that doesn't, is normally not a loner, so to speak, but all of a sudden is, avoiding interaction with their colleagues, with, family, with social events, things like that, could be an indication that there's some sort of issue going on. Um, the increased use of sick time, first responders, starting to burn time, that they normally haven't, or in the past, historically, they haven't, right? Consecutive days off or a pattern of days off. Um, that might be something to look at. Are they calling out because they can't drag themselves out of bed because their anxiety or depression is hitting them that hard, or they were out drinking the night before. Um, Unexplained, increased sick time can be an indication. Lateness, obviously, if someone starts to come in late when they're normally punctual, we want to look at that. Increased citizen complaints ties into the change in demeanor for sure, right? How they interact with the public. You start to get increased complaints on one of your first responders. Something to look at, like what's changed with that person. Um, some big ones that kind of really are red flags. Um, any kind of off-duty incident, especially if it involves, alcohol or some other substance. If you have a first responder that, is starting to have, altercations or, overindulgence at events and things like that, we want to look at that and see what's going on. Someone that comes to work with an odor of alcohol, obviously that's kind of an obvious one. And then problems at home. Um, Unfortunately, and I think I stated this earlier, but first responder problems tend to show up at home, and usually by the time they get to work, they're pretty bad. But sometimes we're able to recognize when there's something going on at home. Um, you know, they might not talk about what's going on with them, but the first responder might share that things aren't going well at home, or there might be some issues, and those aren't things that we should just play off or ignore, especially now during the pandemic when things are so much more elevated. So all common things that we can look for in our first responders that indicate some sort of possible problem. Now, what do we do in response to the pandemic, right? And specifically around first responders. And three simple things that we can do is obviously prevent what they're dealing with becoming a problem. Rehabilitation, when it does become a problem, we provide them proper treatment and get them back to functioning and being able to go back to their lives. And then resilience building, and the resilience building ties into both the prevention and the rehabilitation, right? So if we're doing prevention, we're providing education, we're giving tools to be able to deal with the issues that they may face and struggle with. And that helps to build resilience. And then through rehabilitation, for example, somebody that comes into Karen for treatment, part of what we teach them is to take some of the coping skills that they've used in the past and transition them to maybe more healthy coping skills. Instead of drinking when you're feeling emotions that you're not comfortable with, giving them some other skill to apply to that. And resilience building can be done in both prevention and rehabilitation. First responders are very resilient population. They survive a very long time in an environment that is very difficult, but often they rely on a type of unhealthy resilience that eventually causes problems. So we want to give them healthy resilience and be able to address anything they're struggling with in a healthy, positive way. So when we talk about on a broader scale, like what are we doing in our communities, in our state, and within our agencies, to address this problem that's come about from the pandemic. It's been exacerbated by the pandemic. And across the country, we've seen pre-pandemic a push among first responder professions to establish more peer programs, right? Support programs within agencies, within counties, things like that, to provide ongoing support to their men and women around anything that they may be struggling with. Given where we are with the pandemic, it's even more vital that these resources be available, that peer support teams are put in place if they're not already. And for the ones that are already in place, they need to be properly trained on how to assist their colleagues with the struggles that may arise from the pandemic on top of everything else. There needs to be a process for identifying a first responder that may require additional help. And we'll talk more specifically about what that can look like in a second. But and then we also need to educate our first responders and their families, that there will be or could be a delayed impact from the pandemic for themselves and their families, right? We know that not everybody reacts immediately to a traumatic event or something that has happened. We see this with veterans all the time. They come back from active duty, and years later, problems present themselves. For first responders, are part of that community as well. They also experience that. We want to monitor for psychological issues such as anxiety, depression, PTSD, long after any crisis has passed, and the pandemic is no different. So when we talk about, when we talk about developing a process, the second bullet point there, right? What we're talking about is being able to monitor our first responders and identify when they are struggling, right? Some sort of formalized process, not a haphazard type of, we have services, if you need them, call us. It has to be more proactive. And it needs to continue long after the end of the pandemic, so to speak. And that monitoring needs to include the families. These first responders, try as they might to keep their work separate from their home life, they do bring it home. Maybe not in sharing what has happened at work, but the impact of the job on them is seen by their families and has an impact on the family in turn. So the families definitely need to be included. We also need to conduct ongoing evaluations of the services we put in place to ensure that they're evidence-based and are having the best and the maximum impact they can, right? So that means being honest with ourselves and critiquing what we're doing and making good positive changes and relying on the data and the evidence to tell us whether or not we're doing the right thing. And when we talk about individuals, from an individual perspective, there's a lot of things that the first responders can do themselves, and that we, as treatment providers or colleagues or administrators can do for ourselves as well, but also to kind of promote with our first responders, is to stay informed, right? We need to know what's going on. Rumors can be the most detrimental thing out there. Know what the facts are and stay up to date on what's going on around the pandemic. We need to pay attention to our emotional health. First responders are notoriously bad at this. They avoid identifying emotions and dealing with emotions as much as they can. But in order to be healthy, it's something that needs to be done. It's important that we take care of our bodies, right? Over the last 16 months with the pandemic, a lot of folks have, gotten off of their normal healthy routines, maybe gotten away from exercising, a lot more sedentary activities, a lot of desk work, things like that. So that has an impact on us physically, which can in turn affect us mentally and emotionally. We need to stay connected. First responders, just as important as anybody else to stay connected to family, friends, peers, loved ones, to make sure that they're getting that human interaction, that feedback, that that group that we as human beings, enjoy. We need to learn, first responders need to learn to control what you can and to let go of what you can't. That's a difficult task, but it's something that will help with that resilience and being able to manage, the pandemic both today while they're going through it and years from now after things have settled down. It's important to ask for external help. First responders are very reluctant to ask for help and have a very hard time accepting it even when they ask. They don't make good patients, so to speak. Um, kind of like doctors, nurses, probably not the best patients. First responders are the same way. They're the helpers. They don't like to need help. So they're resistant to it. We know mindfulness is a very effective tool in keeping us focused and centered on what we're doing right now and not projecting too much into the future or living too much in the past. So incorporating some of that into daily activity would be very, very helpful. Um, Avoid too much news. Now, staying informed and too much news almost seem in contrast to each other, but they're not. Um, the news sometimes, will kind of Hollywood uh, the news, information to a point where, it's not always clear what's really going on. Staying informed is relying more on the facts. I think that's an important distinction. Too much news and personal commentary that we see on social media and things like that can be negative. Uh, Seek help when needed. It's really important for first responders to ask for help right away before it gets to a point where you're being told that you need help. Um, First responders struggle with that, but it's the key. If you can get help early on, the process is so much easier. As anyone that's on here knows that's worked in the treatment industry, we'd like to get them as early as possible, but unfortunately with first responders, it's often further down the progression before they do reach out for help. Um, as individuals, we can also be mindful of those around us, right? Keep an eye out for our family, our friends, our colleagues, especially those that work in the first responder world. Check in on them more often than maybe you normally do, right? And then finally, good sleep hygiene. Um, I can't stress enough how important getting good sleep is. When we're sleep deprived, so many issues arise. Physically, we're not operating at our best. Mentally, we may be in a fog or just not at our peak performance, which can lead to safety issues. And when people are tired, they tend to be more emotional. And, there's just so many factors. So even with, longer hours, changing schedules, it's really important that we make the effort to get good, proper sleep, and especially so for the first responders. So what we're talking about here, before I introduce the team here, I want to kind of wrap up what I'm talking about. The slides that we just went through are very, very general. It's a general overview to a pretty significant problem. We could spend 6 hours talking about some of those bullet points there, but it highlights that moving forward, right? We know what it highlights is what's been going on, what we expect to happen, and what we need to do to address what's coming, right? It's going to be years before we see the final impact of the pandemic on our society. And certainly when we talk about the first responders, it's going to be a long time before we see the full impact of dealing with the pandemic and their roles as the protectors and the helpers, what kind of impact that's going to have. So we need to start today to look at these things and say, okay, what are we putting in place as far as education so that we're giving people the tools to recognize, and maybe prevent falling into that rabbit hole? What are we doing as far as treatment interventions, or how are we recognizing that there's a problem? Those type of things all need to we need to start looking at them now and assess that as we continue to move forward so that we can stay on top of this and provide the best care for our first responders. when we talk about first responders, one of the best ways to reach a first responder and get them to engage is through peers and through folks that are culturally competent when we talk about the first responder community. For example, the team that we have here at Karen, first responder team with extensive clinical experience, lots of peer experience. Myself, retired police officer, George Yeager on the screen, retired firefighter, James Nestor, law enforcement. And then some of our other team members, Claire and April, have worked with and treated first responders their entire careers. So they're so competent when it comes to working with this population. That's what's needed. First responders are resistant to ask for help and to mental health professionals. So if we can make sure we make that right connection from the beginning, whether it's with a program like ours, there's others in the country, or with a private therapist that provides those same services, or within the individual agencies out there providing peer services to help bridge that gap between that resistance and connecting them to treatment, that's going to be key to managing the kind of the fallout from this pandemic. So with that, I'm going to kind of step back, open it up to Q&A, and invite James back in to handle that. James? There you are.
Hey, I'm back. John, that was fantastic. I just wanted to let you know there was unfortunately a little bit of technical feedback with your mic. So I apologize for those who were disturbed by that. So we're going to move on to answering questions that were submitted through the registration process, and then moving on to any that have come in from the live Q&A, which seems to be quite a few. The first question, John, is what are your thoughts regarding exposure therapy in regards to treatment for people with first responder related PTSD, especially as it relates to effectiveness, risk of re-traumatizing, and real world efficacy?
Okay, good question. So we know exposure therapy, CBT, has been effective for a very long time. There's a whole lot of research and data and evidence out there that supports the efficacy of exposure therapy for PTSD. Unfortunately, there's not a whole lot of data specific to the first responder population. It's kind of a unique group, and there hasn't been a whole lot of separate research done. That being said, there was a study, I believe it was in 2017, where they did look at exposure therapy, and that was actually a randomized control group, and they looked at that, and what they found is there were three groups, that 10 minutes of exposure therapy, 40 minutes of exposure therapy, and then a control group. And what they found is there was no difference between 10 minutes and 30 or 40 minutes of this therapy at 12 weeks. Both resulted in a reduction of symptoms and an improvement in the overall well-being of the first responders over the control group. So, in general, I think it works. We know that from the data specific to first responders. Other than that study, and maybe there's a couple others out there, there hasn't been a whole lot of specific work done on that. Yeah.
Are there more substance-related issues showing up in first responders? If so, what are some of the interventions that can be used to help with them?
Absolutely. Yeah, I think, over the last year, we've definitely seen an increase in substance use disorders among first responders, abuse, with the isolation, the quarantining, a lot of folks, under increased stress, more alcohol consumption. I saw a report recently where they talked about the increase in alcohol sales in the United States, and it was incredible. So, So for sure, we've seen an increase in that both in substance use and mental health. As far as interventions to be able to address that, I believe peer interventions tend to be the best when we're talking about first responders. You know, a firefighter is going to be more comfortable talking to another firefighter about what's going on. So tapping into your resources, locally, whether your department or the agency has a peer support team, or if there's one regionally, or you reach out, to an organization that can provide that to you. I think that's a great resource to tap into to reach that first responder that might need help.
Yeah, and somebody had sent in one, which you sort of answered with the peer support, but how do you approach a first responder without offending them to discuss, substance abuse or any issue for that matter? Like,
Yeah, that's a touchy one. There's when you're doing it, anytime you broach the subject, of with a first responder and you're going to kind of say, hey, are you okay? Right. Or we think there's a problem. You're going to get a reaction. It may be positive, it may be negative, but I don't think you can do that without some sort of consequence. Um, you can minimize that by approaching it from a place of love and caring, and from a peer perspective, saying, hey, you know, when I do an intervention like that or talk to somebody, I'm able to share, hey, I've been there, I've done that, I know what you're feeling. So that works for me because I have that history, I have that background. Um, Being able to utilize that is great. Without that, you need to come at it from, a colleague or a peer or a family member, a place of, love and care. Um, and even with that, you may get a reaction that's still, they're not happy with you. Um, but that's okay. I think, at least you've kind of broached the subject and put it out there for them to think about. So.
here's one. Please share some specific resiliency techniques. What do you teach when you're working with first responders?
Yeah. So we one of the things that we do spend a lot of time with our first responders is mindfulness. Um, First responders will often talk about everything that's happened and everything, they project to the future about problems that haven't even happened yet. So we spend a lot of time here at Karen, doing mindfulness practice and encouraging, teaching our patients, especially in the first responder program, to kind of, let's try that. Let's start doing that. Even if it's just, mindful breathing, right? Paying attention to your breathing. When you start to feel, anxiety coming on, take a minute and sit and do some mindful breathing. In today's day and age, there's so many apps and, online things available. It's an easy, way to help us deal with our emotions and help these first responders, back it down when they become, activated, and kind of get through that moment, as opposed to turning to their normal coping mechanism, which may be, drinking or using, medication. So or mindfulness is one of the ones that we use quite often.
Yeah, to piggyback on that, somebody had asked what kind of support programs, you mentioned earlier that are effective for first responders. Could you elaborate on that?
Absolutely. So in the first responder world, what we're seeing, and we have a lot of teams locally, you have peer support teams that are made up of members of the first responder profession. So if we're talking about firefighters, we're talking about a team of firefighters that get some level of training and education to be available, to, keep an eye on, to support their colleagues in the workplace. And that tends to be the most effective way to do it. Same thing with law enforcement, a peer support team to be trained and to be present. Some of the other resources that are available are peer support meetings, right? Separate from maybe your agency or a county or a regional team are, peer support meetings. And what I mean by that is, a group of first responders that get together to support each other, on a regular basis. For example, one of the things we do here at Karen for our first responders is we have 3 what we call resilience and recovery meetings each week, and they are peer support meetings for first responders. They're virtual. They're Sunday or Friday night, Sunday night, and Monday night, and they are well attended. You don't have to be a Karen patient to attend them. We get folks from all over the country, some that have come through that are alumni of our program, but others that are just looking for support, and they join the meeting. It's they're no cost, and it's facilitated by a trained peer. Those types of meetings, there are others available out there, but they're the types of things that first responders respond best to, other first responders helping them.
Yeah, one of the questions related to peer support in, they too, from, working, directly with, the first responders, how would you sort of help them cope with the stressors of, dealing with the first responders constantly?
If I understand the question correctly, Jake, you're talking about like a clinician who works with first responders regularly, or a service provider.
Yeah.
Yeah, I mean, it comes down to self-care, right? Um, as clinical folks, therapists, we hear all the bad things that are going on in other people's lives and the struggles, and it can have an impact on us. So it's really important that we take care of ourselves emotionally, and make sure that we're doing our own self-care. And sometimes that means taking a step back, right? Getting away from it. Um, what I found is, being able to talk to other clinicians that work with the same population, is helpful to kind of bounce off whatever I might be going through or feeling or struggling with. So my suggestion would be to try and, align yourself with other folks that work with the same population, that work with first responders, that understand how that type of work might impact you, and be able to support you, in dealing with that, and support each other.
Here's a great question. As we know, first responders are, like to be in control of the situation. And somebody asked, do you have any suggestions on ways first responders can let go in a way that will allow them to open up and be accepting of getting help? And what has worked, in your previous experience?
Yeah, and that's the biggest challenge. Even when a first responder comes into treatment, often we see it here at Karen, they're here, but they're still resistant to treatment, right? And really what we do is we try to break down that barrier, by letting them know that it's okay to not be okay, so to speak, right? And for us, what really helps with that is the peer aspect of our program, is having other police officers and firefighters be able to share with them, like, hey, I've been through the same thing, or I can understand how you're feeling. This is what I did, and it worked for me. And what we've been able to do is that type of interaction with the peers lowers their resistance to the mental health side, to the clinical side of treatment, being more open to taking a look at their underlying issues than they may have been before. And we do that through the peer meetings, and we also do that through individual one-on-one peer sessions while our patients are with us. So, the clinical piece is hard to get to sometimes with this population. You kind of have to get them to a place where they feel safe and comfortable and trust, right? First responders trust each other almost inherently, but they're very slow to trust mental health professionals. So establishing that trust, whether it's through peers or through that, therapeutic alliance of the counselor, sometimes it can take time to do that, but that's the key to getting a first responder to be open to the therapeutic process. Yeah.
If here's a good one on gender. do you notice any differences treating males versus female first responders?
Well, I mean, there's some differences, of course, but in general, within our program, unless they indicate that they would prefer otherwise, our female patients, do the exact same program as the male patients. So, and they often prefer that because when they're at work, they're doing the exact same job. They don't want to be treated differently. And we see a lot of the same behaviors, right? They're strong, they're A-type personalities. They don't want to be seen as weak. They don't want to, be seen as having a problem or being broken. So there's a lot of the same resistance as far as the profession, and then the gender differences are, typically more along what we would normally find in gender differences, regardless of what the profession was.
And just keeping an eye on the time, I've got one other question. I'm going to assume the answer is yes, but do you know if first responders are experiencing an increase in other medical issues such as high blood pressure, heart issues, or diabetes during this time?
Yeah, I couldn't specifically point to and say, yes, I know that for fact, but it makes sense. If they're under more stress, they're taking less care of themselves maybe than before, they're less active, less sedentary, all those things tend to rise regardless of your profession. So I wouldn't be surprised if that turned out to be the case. And, we probably will know that down the road at some point, how significant it was,
Well, I'm going to stop you right there. John, a fantastic presentation. I hope everyone enjoyed it today. I want to thank all of our attendees for joining us. As a reminder, we are offering 1 APA credit for today's presentation. Please keep an eye on your email for a personalized link to the evaluation from CEO. We have several additional opportunities coming up this month to earn continuing education credits, which are now listed on your screen. Next Friday, May 21st, our Karen, Florida webinar series will include a presentation entitled Applying the Polyvagal Theory in a Clinical Setting, Neuroception and Co-Regulation in Trauma-Focused Practice. 1 social work credit will be available to the attendees. Then on May 26th, we'll provide a presentation about treating the Jewish patient, which will be eligible for 1.5 APA continuing education credits. And both of these webinars are complimentary and registration is open now. So watch your email for details on this webinar for a link to sign up. Lastly, we'll be hosting a virtual open house for older adult program on May 20th. This presentation is the next best thing to visiting our campus in person. You'll have the opportunity to get a firsthand look inside our facility, hear more about the program, and meet our clinical team. Please visit the link on the screen to sign up.
Thanks, everybody.
And finally, please reach out to your local regional resource director at any time for additional information, resources in your area, or questions regarding admissions to any of Karen's program. We'll shoot out a rebroadcast link shortly. And thank you for joining us. Thank you again, John, and everyone. Have a great afternoon.